We're going to have a closing panel discussion now, which is going to be moderated by Dr. Scott Leischow. He's a professor at the College of Health Solutions and Director of Clinical and Translational Science at the Arizona State University. Most of his work is translational in nature, dedicated to moving research into practice and policy. So he's going to be leading a discussion with Matthew Farrelly, Andrew Hyland, and Robin Mermelstein about where we should go from here, given the discussion that we had today and yesterday. Dr. Leischow, if you're ready, please take it away.
Thank you so much. Appreciate it. So David Mendez asked me to say a few words before jumping into the panel, and I'll do that and introduce the panel. But just a few thoughts that I had after the last few days are these. First of all, I mean, the outstanding talks that we've heard include a broad array of data sources and methods, all dedicated to better understanding the science and potential impact of nicotine reduction and flavor restrictions, and they demonstrate the value of exploring the interplay of a complex variety of questions that need to be explored via multiple modeling approaches in order to inform regulatory policy. We all know that it's important, it's critical. It seems to me as I was listening to the talks that this constellation of papers reflect an orientation toward a systems thinking approach via using different modeling approaches, econometric, agent-based, structural equations, and so on, that provide actionable data for scientists and regulators, and also raise new questions as new data are better understood and become available more rapidly. I'll state the obvious. We're not talking here about a collection of randomized clinical trials, which I've done many of, but in an expansive, complex, and often nonlinear mix of data and approaches that can be highly impactful, but also challenging for many people to understand. Yet at the same time, they represent a fraction of the modeling questions. What we heard the last few days represent a fraction of the modeling questions and approaches that have the potential to better understand complex relationships. For example, there are many additional sources of data that could be important for understanding complex relationships. And there's much more that we can learn by understanding how knowledge networks function so that we can speed knowledge exchange among relevant stakeholders to likewise improve dissemination and implementation of evidence. I thought Dr. Blakely's presentation represents one really good example of how learnings from other regions of the world can be of tremendous value to the U.S. and in the U.S. And of course, the FDA and NIH-funded data that are shared broadly benefits the global knowledge network as well that are dedicated to evidence-based regulatory practices. But I guess in short, from my perspective at least, kudos to all of the speakers for showing us a tremendous value, or showing us the tremendous value of modeling to simulate and characterize complex systems in a way that can speed and improve nicotine reduction and flavor restriction tobacco regulatory processes. So thank you all. Just a great couple of days. So for this panel, I've developed a number of questions for the panelists, and they've had the opportunity to provide input on them. We're not going to have time for questions from attendees, so I want to make you aware of that. All three panelists are folks I'm not going to provide in-depth summaries of their extensive expertise, and they do. These are folks that represent decades of experience in the field. Dr. Hyland, of course, is chair of health behavior at Roswell Park, the PI on the PATH study, PI on ITC project, and for many people that don't know, he's also principal investigator in the New York State Quit Line and has played a significant role in the treatment field. Dr. Mermelstein is a distinguished professor at University of Illinois at Chicago in the Department of Psychology, but she's director for their CTSA there, and of course, one of the PIs of the CASToR initiative funded by NIH and FDA, and Dr. Matthew Farrelly. Welcome to your new role. Good to see you. It's been a while. And so, as you all know, Dr. Farrelly is director of the Office of Science at CTP, and before that, he was chief scientist and director of the Center for Health Analytics, Media and Policy at RTI International. So I'm grateful to have these folks on the panel. So I'm going to just start out. The first question is really to all three folks, and then we'll ask some other questions that are more drilled down for specific panelists. But for all three of you, after listening to the talks and reading published articles on the use of modeling approaches to understand complex questions related to tobacco regulatory science, if you would, please provide your overall view on the role of modeling in our field, particularly regarding nicotine and flavor restrictions. So let's go ahead and start with you. I see you right first on my screen, Robin. If you begin, and we'll go to Andrew and Matthew.
Thanks, Scott. And I'll just echo that indeed these have been incredibly wonderful presentations, and my mind is just spinning and trying to quickly grasp and incorporate all the data that we've seen and the implications. I, like Scott, spend a lot of my time thinking about translating research into action, and whether it's policies or practice. And modeling is a key part of that. And I think in the last few years, because of COVID, the public and policymakers have all gotten familiar with models. We all started with thinking about flattening the curve and what modeling does and how many people are going to die and what this. And so people started to get the lingo, and then they got kind of overwhelmed and burned out. And so I think while we're all being the geeks here, talking to other geeks, and sorry if I don't mean that in an offensive way to anyone, who we really have to talk to are the people who are going to make the policies, people who are going to live with the policies, and those affect our norms and how well people feel compelled to abide by whatever those policies are. So I think we need to think about cooler ways of translating this enormous complexity, rather than thinking about what variables we didn't include, because you've all been stellar at thinking about what the limitations are and what we wish we could have had and what more data we need. I love Tobacco Town. And when I was listening to that talk, and I'll confess I wasn't really familiar with Tobacco Town before that, I kept thinking of dating me with Scott's decades, which is true. When my son was younger, he used to play these computer games of Zoo Tycoon and Railroad Tycoon, which was creating these worlds where you create scenarios and in real time you see how they play out, and you manipulate the policy of how much is admission, what are your choices, what concessions do you have. That's what we need to do. We need to create some games that people can interact with live and see what the effects of and how would they react. So I think part of the translation of our policies is letting our key stakeholders, consumers, policymakers, advocates, start to interact with these algorithms to really start believing what the modeling is saying and make it real and in a fun way. Otherwise, we're going to tune out the people who need to listen. And maybe that's not the right model, is making a Tobacco Town game, but that's a cool concept of what those researchers did. And that may be one way to start to think about how to translate. Let people interact with data, let them play, democratize it in a way that gives other people a sense of it's real and here's what happens. So maybe they'll believe us and understand us more.
Cool. Thanks, Robin. Andy?
Yeah, fantastic sessions. So whenever I modeling, I think of the words that have been attributed to the great philosopher Yogi Berra. So the Hall of Fame baseball player that always had a funny way of expressing things that, making predictions is hard, especially about the future. Well, of course. And these things are hard because they haven't happened yet. Many of these policies, a very low cigarette nicotine standard hasn't happened before. How do we know what's going to happen? So where the data inputs that that are there. The real advantage to modeling that I see is it allows you to play this what if game. I think maybe extending Robin's remarks, to play around to see what would happen without actually having undergone that experiment. You can simulate it, you can forecast it, you can try to predict what's going to happen to give us a window in the future, not unlike the weather. I mean, it really, which is all model-based projecting. And I think to Robin's point, the consumer or the policymaker just needs to know if they need an umbrella for tomorrow. And so the complexity that doesn't, maybe if you're hardcore, if you have the Wonderground app on your phone, then maybe you're hardcore into the more modeling with your weather. But if you just watch the Weather Channel, then it's just kind of just the facts right there. Maybe two other points that highlighting there, because these policies generally have not happened here in the United States. They have happened in other places for the most part. So other countries have banned menthol cigarettes. Canada, right in my office, 5 kilometers, Canada, very close. What was their experience? The EU, what was their experience? And then also that's at the macro level, but at the micro level, those data inputs can be coming from smaller experimental types of controlled studies. Again, in the absence of data, we've heard a lot about survey measures, which are fantastic, but there's opportunities to look abroad and then also to look within for a deeper dive. And then ultimately, the comment was made earlier about helping to prioritize what things matter. Tony Blakely's talk was just incredible on the New Zealand experience. And that talk is the whole package of activity that's happening in the smoke-free 2025 New Zealand plan. It's the cigarette nicotine standard. Nothing else matters. It just swamps it. So if you're looking to say, well, how can I put, if you're a student out there, if you're a young person looking at how can I put my mark on the world, the modeling can help identify where the places are, where the levers can be pulled. And again, Tony's talk was an example of that.
Thanks, Andy. Matthew.
Thank you. Great comments from all of you and great presentations. I think going back to your original question, Scott, clearly a key thing is to be able to understand the public health impact, and these models do that. And I think Robin was trying to stress the communication side of it, making it easy to access these results. And I think back to David Levy and SimSmoke, and I was on the expert panel, I think with Andy, a long, long time ago, with Robert Wood Johnson Foundation meetings and the like. And David back then would show, graphically the impact with and without. And I always loved that. And I think we have to think about ways to graphically illustrate the impact so it's just really easy to digest. Because I think the thing that is so challenging with modeling is you have to go from the weeds all the way up to the forest level so that the consumers of the outputs can really understand them. But at the same time, you have to be ready for the criticisms. Oh, you're not accounting for this, you're not accounting for that. And David Levy made the point about just the complexity of the marketplace and the uncertainty of the modeling. And if anything, the future has to be such that these models grapple more and more with the complicated marketplace that's out there. And then I think the other thing that I always like to see, and some do this consistently, some don't, is just showing the validity. If you are predicting the past with your model compared to actual data, I think it's really important to show how accurate those models are, because when you're doing your base case or business as usual into the future, that's really reliant on how well you predicted the past. And I think making sure that we do that as a way that people can also, at a fairly high level, feel confident about the modeling, without getting into the nuts and bolts. And then, one other thing that just to pile on to the complexity, one thing that I was surprised to not hear about, when talking about cigars, and cigar models are challenging because of, they don't have the benefit of all of the cigarette data that's been collected for so long. But we're in this environment where states increasingly are legalizing cannabis, and cannabis products have flavors. And a lot of youth and young adult use of cigars is really about blunt use, and the PATH data has the blunt use data. But I think that that's something that has to be part of that context that others brought up. It's a very real context. So anyway, I'm sure you have a whole list of questions, Scott, so I'll let you get to them.
Well, I do. And actually the next one really ties into what actually all three of you have raised. And, Robin, you talked about the notion of sort of gamifying, some of these complex relationships, which would be fun, interesting, and valuable, I think. But, taking that a step further, I'm curious to hear what you folks think about what we as a scientific society can do to better educate the non-scientific community about the value and interpretation. I mean, what are some, can you think of any concrete things to do other than, again, I think the gaming idea is cool, but a lot of people aren't going to play the game. So, what can we do to take these highly complex methods, outcomes, interpretations, and help the general public better understand them? So any thoughts on that from all three of you, actually?
I can start quickly. I've over the years I've kind of come into this world and out with the simulation modeling and so I don't know what has been done specifically, but being a guy who focuses a lot on communications and evaluating communication campaigns, I wonder how much work there is of talking to the stakeholders or the people you're trying to influence, or just a collection of people who you might want to consume these results, and ask them for feedback. Present it in lots of different ways, kind of like a focus group, and see what resonates with them, to see which methods of delivery are most accessible and convincing to the people that you are ultimately trying to influence. That's just something.
I'm sorry if I could jump in. Well, it sounds to me like what you're saying, but correct me if I'm wrong, that one could turn this into a research question. And test different approaches that could benefit the community. But I don't know if that's what you're saying.
Yeah, no, absolutely. Back to Robin's point about COVID and modeling, one of the things that also exposed people to is really beautiful infographics, and the whole world of data science has just taken off in recent years. In terms of really sophisticated ways of displaying information, complex information in a way that's accessible. A lot of the major newspapers, I think of New York Times and Wall Street Journal, have just brilliant ways of showing data at times. And, and so that's another, that's one of the methods that you could use. But I think of presenting it in different ways, and then testing, how the intended audience reacts to them in terms of greater understanding, interest, et cetera, I think would be something that we should keep in mind so that all this great work gets put to use.
Andy, Robin?
I think there could be, maybe through CASTOR. All the CASTOR is one, T4 is a collection of them, his whole portfolio. They all have different shades of the same issue. How do you get the results in the format that for the stakeholders to digest, so it's plausible that CASTOR could be tasked with, dissemination and implementation type of activity that's there. From what I see, just broadly, obviously the people at this meeting are very, you got to love numbers to be here, but for a lot of people, that's not, I will use the term statistical sorcery. For a lot of people, it's like, yeah, this is all fine, but it's just, I just don't believe it. And that speaks to maybe Matthew's point about greater validation David Levy and I did a paper in 2000 about what would happen if youth smoking were like reduced, different strategies. And we had projections way, way out in the future. One of them was to 2023. So that's today. But the policy that basically dramatically clamped down on youth initiation and delayed some of it into young adulthood got almost exactly right the number of cigarette smokers projected in 2023. So that's great, to look back, and it lends value to that model, to the SimSmoke model, and maybe is one way of combating, that perception that it's just, you slide rule kind of people that are making up numbers to get, exert the government's will on people, so.
Sure. Robin, anything else to add?
Oh, well, some of this is, as you suggested, Scott, perhaps a research question. There's a lot we know. We know about this is essentially how do you communicate two sides of a coin? Lives won, lives lost, saved or lost, and this is risk communication. And we've not, and there's a large literature on that. We've not used that to inform how we are communicating with our audiences. So we probably need to get out of the shell here. Some of that's been used with trying to motivate people to stop smoking, but not broadly to communicate what are essentially risk perceptions, or how do you present the modeling results. And so Matthew's point about talking to people, and whether it's focus groups or quick message testing, would really be important.
So let me take it in a slightly different direction. So a number of the talks over the last few days have talked about modeling approaches to better understand and address underserved populations. So I'm curious to get your thoughts, and again, right now it's for all three of you. How can we elevate modeling in a way, or expand modeling in a way that can maximize the benefit to real-world regulatory decision-making, specifically in a way that would benefit underserved populations in the U.S., but also low- and middle-income countries globally, particularly given the need to address and characterize countervailing forces, like industry pushback and things like that. So can you think of things that we need to do, that can do, should do with respect to modeling to better address underserved populations?
I'll start. I can think of things only that would make it more complex with modeling, but let me put a different lens on this. In some of the talks that presenters talked about the importance of context, that if you model something, what's the context? But the context there was always in terms of the marketplace and tobacco industry. What isn't considered is what's the context of an individual's life, especially for individuals from low income, minoritized, underserved groups. So tobacco, they make choices about that, not just relative to other products, but relative to other parts of their lives. So I think to start to incorporate, and this only makes it a million times more complex, but as we start to deal with specific populations, I think we have to remember tobacco isn't always the number one thing in their mind and how they make decisions. We're trying to influence how people make choices. So we also have to understand choice relative to what else going on in their life. And maybe those are factors with certain populations we start to put into models to really contextualize in a different way what the results mean.
Andy or Matthew?
Yeah, just a couple of thoughts. One, I thought one of the presentations really made a good point of, like menthol, and looking at the influence of a menthol ban on African-American population. And again, going back to COVID, I think that thinking clearly about how to communicate results in a way that is really illustrating the population benefit, and being mindful of potential sort of unintended consequences about the way that you communicate. Because I think that the way COVID was talked about, for certain populations, it made them seem like they were the ones at fault. For example, populations that were overweight or obese, it made it seem like they were to blame, rather than, the various health systems, and the legacy of discrimination. in the healthcare system for certain populations. So I think that, again, paying attention to how we communicate findings is important. But I think, I guess while it does get complicated and the data limitations get more challenging for certain populations, I think the other thing is, as different tobacco product use rates go down, it's easy to sort of gloss over the populations that are disproportionately affected. And I like the way that, the earlier presentation talked about the relative impact and benefit to certain populations. And I think that's a good way to frame the results.
And to add to that, I think Jamie Tam put on a master class at SRNT with her talk about modeling and health equity kinds of elements. So Jamie, we're looking to you to help lead the way as we go forward here. A second point would be a lot of it is, are we measuring the subgroups that are most important? So that comes a lot of times from the survey instruments, from those data inputs. I think there's opportunity for modelers, for the data collection systems to have more direct communication to try to make sure that we're capturing the things that are relevant. And maybe a last point is that, adding subgroups increases the complexity of the models, like an order of magnitude. Every extra factor makes it that much more challenging. And I would say, let's start with something, pick a factor. So it's easy to look at the aggregate levels, lots of data, lots of models, maybe pick one factor and then add in those complexities. And then one can assess the marginal value of adding an added complexity factor. And those priorities, I think, can come from Center for Tobacco Products, at least from a tobacco regulatory science thinking. And again, and that's where that dialogue can help create that efficiency.
So let me add to the your points about complexity are good. Let me add to that a little bit with the next question. So I'd be curious to get your thoughts, all three of your thoughts on whether there's a need to develop some sort of consensus by the scientific community on the use, relevance, validity, generalizability of different modeling approaches, and perhaps explore ways to triangulate outcomes of different modeling approaches to see degrees of congruence and so on. And I realize, that in of itself would be an incredibly complex process, but, there are a lot of different modeling approaches, and I think that adds to the challenge of interpreting them and making sense of them collectively. So I'm curious, what does the scientific community have a role in trying to get a handle on these approaches and make sense of how they relate to each other or don't relate to each other in terms of policy? Any thoughts on that?
Well, certainly the scientific community has a role here, I would hope, in at least providing some parameters, some guidance. But as a non-modeler, but as a consumer of models, what I see a lot in my university and other people, everyone is talking about machine learning as taking over how we make decisions. So are some of these, I think there's a big question about where are the kinds of models that we saw today fit within this, what feels like the wild, the models everyone here is using feel very principled and thoughtful, and people make very conscious decisions about what their inputs are. And then I go into hospital systems or other places where machine learning takes over, and for coming up with algorithms, which maybe, it's an empirical but non-principled approach per se. Where does modeling fit into that? And is it going to be outweighed by this enormous push towards other kinds of machine learnings? And I don't know, but maybe these are very, very strong principled models, need some firm claim of ground not to get outweighed.
Matthew, Andy, any thoughts on that?
I mean, I might add, I think academically, yes, that should happen. I would put it as a value-added piece. Certainly adds validity and helps us understand, but that, you know, and that's what scientists should be doing and working those elements so that ultimately the product is the, you know, reliable product that consumers, you know, policymakers, regulators can lean on. So I might frame it rather than consensus though as maybe guiding principles or successful practices so that we don't get bogged down, because ultimately it's like, well, your model is wrong and no, your model is wrong, you know, and it gets into, but whereas I think there's room, definitely what I saw here is there's room for lots of different approaches, and it's about sort of converging evidence rather than any specific approach.
Anything you want to add, Matthew? If not, that's okay.
No, I had a leftover thought on health equity, but I'll
oh no, please go ahead. No, jump in on it.
Well, I think that it's great to have really high quality population level data from studies like PATH. But a lot of these models are pulling in data from lots of different sources. And one of the things I did an experiment with data collection, a couple of years ago, and because I was concerned when I looked at response rates by different community characteristics, like the percent of the census block that was African American or Latino, and I looked at response rates, and they were disproportionately lower, and it got me thinking that, are some populations that are really just sort of disengaging, and those are the same populations that have the highest health risks. And so it made me worry that these estimates of disparities are actually probably grossly underestimated, because you need to do that extra effort, potentially data collectors who match the characteristics of the populations that you're trying to collect data from, or just making sure that you really interrogate your methods to make sure that you're reaching populations that may be disproportionately affected by, tobacco use or whatever the health condition that you're concerned about. Because when I did that experiment, then I did follow up with more intensive effort in data collection. What I found was higher smoking rates among those, minoritized populations. And so I just raising that as, it's an input, one of the inputs that we kind of take for granted, but, we do have to make sure that we're keeping an eye on the quality of the data, not just overall, because I think, once the data are weighted, we sort of think that the weights are magic and they fix all problems, and they actually don't. So anyway, it's just a stray thought that has been on my mind a lot lately, to make sure that we're really getting an accurate picture of health disparities that exist out there in the world of tobacco.
Great, thank you. That's great. So they've given us an extra 5 minutes for this panel, so we've got time for another one or two questions. So let me jump to the next one I want to talk about. Is there, do you folks think that there's a responsibility of some sort to make data and methodologic approaches used in the models publicly available? If not, why not? There was some discussion about that yesterday. David Levy was kind of talking about it a little bit, but it occurred to me as we're getting more engaged with models over time, understanding where the data are coming from, the assumptions of the models and so on are critically important. So what's the responsibility to make the assumptions and methods available, if there's a responsibility at all? I don't know if you all have thoughts about that or not. And Matthew, I recognize you're in an awkward position in your government role, so I if you can't answer, I understand. I've been there. I know what that's like.
Of course, there should be transparency But it's tricky because there's intellectual property, so it's like here, we've spent 10 years developing this model, go ahead and, use it. So, but I would say COVID is a great example where there was tremendous intellectual scientific discovery done for the public good while there were protections for intellectual property and corporate interests along the way. So I don't have a specific roadmap, but it definitely can be done. And, science is all about building on what we learned before and then adapting and growing. So that levels of transparency, I think, are necessary. And it's just a matter of working out, the specifics, how that's going to work.
Mm-hmm. Anything to add to that, Robin? Okay. So next one that I have is, I'm going to direct this first of all to you, Robin, but it's relevant for all of you. So I'd like you to talk a little bit about the role of the coordinating center, CASToR, but other, other entities as well, other funders, but also research organizations like SRNT. But what's the role of coordinating and consensus building organizations for fostering these modeling efforts, elevating the visibility, interpreting results, increasing collaboration on modeling initiatives and things like that. I don't know if you have any thoughts about kind of where we go from here, and who does that. It can't be all CASToR because that's FDA, NIH specific. SRNT could have a role. Other organizations could as well. But I'm curious to see how you look at this mix of organizational entities, and not just you, Robin, but let me start with you.
Yeah, and certainly I flip in different parts of the Venn diagram of all the different organizations. So for people who don't know, CASToR is the coordinating center for the CTP funded scientific activity. So not just the T-cores, but other funding as well. And so we do have as our aims a lot of both synthesis and analysis and dissemination of materials. But for me, one of the key aims is the collaboration building so that there's synergy, because what could be accomplished by any one researcher could therefore get amplified by sharing data together, allowing for people to think through, hey, can they all address that question, and having this ability to have the same question, but either with different populations, different samples, different methods, but pull them together in a way that keeps us, tries to break down the silos and the walls so that we really can hopefully reach agreement. And rather than publishing a million other papers that conflict, can we somehow synthesize and put together an organized, whether it's consensus or at least easy to sift through compilation of what all the issues are. So I hope that's what we can do as a coordinating center in part, and give people that voice and opportunity to collaborate. Now, CASToR only is, CTP funded. So there are many other organizations, and like SRNT will cover international. SRNT is an international. And what we've seen is in the policy arena and modeling, we need the inputs from a lot of other countries. And so I think SRNT can certainly play an organizing role by helping to facilitate some of those cross-country comparisons more, the inputs, what are our lessons learned that way.
Great. Any last thought, Andy or Matthew, before we close out?
Well, I guess I'll just quickly say, seeing these colleagues that I've been with for so long sent me down memory lane a little bit, and but I remember like how formative and important it was, more than 20 years ago when the Robert Wood Johnson Foundation and their substance abuse policy research program brought us together as grantees. First, couple 3 days, and it was really an opportunity to discuss whatever the topic was in depth, debate, discuss, to move the methods forward. Back then, it was a lot about policy evaluation. And I think creating the space for people to get together to build consensus, to challenge the different assumptions and methods in a way that's organized and constructed to lead to better models and better communication, I think would be great. I don't know what mechanism is the best for that, but I just, as something that had a real formative influence on me at the beginning of my tobacco control career, I would hope that modelers today would have the same opportunity, because while these kinds of exchanges are great, we just consumed how many models in how many minutes, and there's really not the opportunity. It's not the venue, to use Robin's reference, for to geek out on the models. Like, you kind of need to at a certain level, and I own that. I'm a geek. So anyway, yeah, I think it's a great thing to keep focused on.
Thank you so much. Andy, any last comments?
Absolutely, Matthew, to stroll down memory lane on those meetings, great meetings. CAsToR Coordinating Center, I can see it as a venue for bringing the priorities from CTP. I think it's got to start from that to the modelers saying, these are our gaps with our data. A lot of times you make do with what you have, but if you had a wish list, and then maybe the other grantees, the other stakeholders may be able to, bring to that and have a forum for those discussions that are there. And then the mechanisms that fund that work could come from traditional grant mechanisms, but also like a more surgical contract type mechanism, very specific. There are two product standards right now. That's what you need. That's where, the issues. So, the using the array of funding mechanisms to get the information that's needed into the process. There are options for that.
Wonderful. Well, thank you, all three of you, very much, and great discussion. And again, I thank everybody for staying in and participating. So I'll turn it back over to you, Ritesh.